Now you see a woman working in the kitchen. When she suddenly burns her hand on a hot pot, she reacts in pain. Her brother hears her and quickly approaches. Before touching her, he makes sure the stove is off and the heat source is safe. He checks her responsiveness by speaking to her and gently touching her shoulder. She is alert and breathing normally. Now the correct first aid begins. He places her burned hand under cool, running water. The water flows gently over the skin to reduce heat, swelling, and pain. He keeps it there for up to 20 minutes. Next, he removes her rings and bracelets before swelling gets worse. After cooling, he loosely covers the burn with clean cling film or a sterile, non-adhesive dressing without pressing on the wound. Then, he elevates her hand on a folded towel to reduce swelling and offers simple pain relief like paracetamol or ibuprofen if appropriate. Mistakes are shown now: applying ice, using toothpaste or butter, popping blisters, or using tight bandages. These can make the injury worse and must always be avoided.